Did you know that nearly 40% of the world's population is now overweight or obese? That's more than 2.8 billion people facing serious health risks simply because of the way we live. Hello, and welcome to today's video. In this video, we're going to dive into one of the most pressing public health issues of our time, the global obesity epidemic. We'll explore how lifestyle choices are contributing to this crisis, why it's such a dangerous trend, and what can be done about it. Before we dive into the consequences of obesity, it's important to understand what it really means. Obesity is defined as an excessive accumulation of body fat that presents a risk to health. According to the World Health Organization, WHO, a person is classified as obese when their body mass index, BMI, exceeds 30. In simple terms, obesity isn't just about being overweight. It's when the body accumulates so much fat that it begins to interfere with normal bodily functions and raises the risk of serious health problems. Imagine your body as a car. When the car is overloaded, it can't run properly and parts begin to fail. The same happens in your body when it carries too much fat. Organs like the heart, liver, and kidneys have to work harder, which can lead to diseases like heart disease, diabetes, and even cancer. The strain isn't just on your organs, but your entire system, which can lead to premature aging, disability, and even early death. The global obesity epidemic is not just an issue of appearance, it's a life-threatening crisis that affects individuals, families, and entire communities. Obesity is a leading cause of chronic diseases such as heart disease, stroke, type 2 diabetes, and certain cancers. In fact, obesity contributes to over 2.8 million deaths annually worldwide, making it one of the leading preventable causes of death. The consequences of obesity extend far beyond just physical health. For example, people living with obesity often experience mental health struggles such as depression, anxiety, and low self-esteem. As a result, they may face a lifetime of medical bills, reduced quality of life, and the inability to work or participate fully in daily activities. Obesity puts enormous pressure on healthcare systems, with billions of dollars spent each year on treating obesity-related conditions. We are also seeing a rise in obesity among children, which is particularly concerning. Nearly 1 in 5 children worldwide are overweight or obese, and these children are at higher risk for developing the same chronic conditions that affect adults. What was once considered an adult issue is now a growing problem among young people. If this trend continues, we can expect the health risks and economic burden to increase exponentially in the coming decades. Obesity is caused by a complex interplay of factors, most of which are linked to lifestyle choices. A key factor contributing to the obesity epidemic is the modern diet. With an increase in processed foods, sugary drinks, and high-calorie snacks, many people are consuming more calories than their bodies need. Unfortunately, these foods are often lacking in essential nutrients, making it harder for the body to maintain a healthy weight. The availability and marketing of unhealthy food, especially fast food, make it easier to make poor dietary choices. Alongside poor diet, a lack of physical activity is another major contributor to obesity. In today's world, many people live sedentary lifestyles, spending hours in front of screens, whether for work or entertainment. This decrease in physical activity, combined with the rise of more sedentary jobs, leads to a higher likelihood of weight gain. Our bodies are designed to move, but without regular exercise, we burn fewer calories, making it easier to gain weight. Additionally, environmental factors play a role in the obesity epidemic. Many cities and neighborhoods are designed in ways that discourage physical activity, lack of walkable areas, unsafe neighborhoods, and limited access to parks or recreational facilities all contribute to inactivity. In some areas, the availability of healthy food is also limited, creating food deserts, where people have limited access to fresh, nutritious options and are more likely to rely on processed, unhealthy foods. Moreover, genetics can influence how our bodies respond to food and exercise. Some people may be genetically predisposed to store fat more easily, making them more susceptible to obesity, especially when combined with an unhealthy lifestyle. However, it's important to note that genetics alone is rarely the sole cause of obesity. Lifestyle choices still play the dominant role. The combination of these factors, diet, lack of exercise, environmental influences, and genetics creates a perfect storm for the obesity epidemic to thrive. To better understand the impact of obesity, let's contrast two key areas: public health versus clinical medicine, and preventable diseases versus genetic diseases. In public health, the focus is on preventing diseases and promoting well-being for entire populations. Public health measures aim to reduce the risk factors that contribute to conditions like obesity, such as promoting healthy eating, encouraging physical activity, and creating environments that support healthy lifestyles. Public health addresses the root causes of obesity through education, policy changes, and community-based interventions. In clinical medicine, the approach is more individualized. Healthcare providers treat patients who are already experiencing the negative effects of obesity, such as heart disease or diabetes. While clinical medicine plays a vital role in treating obesity-related conditions, it's often reactive rather than proactive. Public health, on the other hand, focuses on prevention and making broad, systemic changes to reduce obesity before it occurs. When comparing preventable diseases to genetic diseases, obesity falls into the first category, preventable. Unlike genetic conditions, which are inherited and largely out of an individual's control, obesity is heavily influenced by lifestyle choices. Through changes in diet, exercise, and environmental factors, obesity can be prevented and, in many cases, reversed. The key difference is that obesity, unlike many genetic diseases, is a crisis we have the power to change if we make the right choices at both the individual and societal levels. So, what can we do about this growing crisis? The good news is that action is possible, both on an individual level and through societal changes. At the individual level, the most effective way to combat obesity is by adopting healthier lifestyle habits. This means focusing on balanced nutrition, such as eating more fruits, vegetables, whole grains, and lean proteins while cutting back on processed foods, sugary drinks, and excessive fats. Regular physical activity is also essential. The World Health Organization recommends at least 150 minutes of moderate-intensity exercise per week for adults, which can be as simple as walking, cycling, or swimming. On a community level, we need to create environments that encourage healthy living. This includes building more parks, promoting walkable neighborhoods, and improving access to fresh and healthy foods. Communities can also support wellness programs that offer education on healthy eating and active living. Schools, for example, can play a key role by providing nutritious meals, offering physical activity programs, and teaching children the importance of maintaining a healthy lifestyle. At the policy level, governments can implement policies that help reduce obesity rates. This could include regulating food advertising, especially targeting children, taxing sugary drinks, and ensuring that healthier food options are more affordable and accessible. Policies that encourage the creation of public spaces for physical activity, along with policies that limit the marketing of unhealthy foods, can make a significant difference in tackling obesity on a larger scale. There are also medical interventions, such as weight loss surgery and medications for individuals struggling with severe obesity, but prevention through lifestyle change remains the most effective and sustainable approach. To sum up, the global obesity epidemic is one of the most pressing public health challenges we face today. It's a crisis that impacts not just individuals, but entire societies, contributing to millions of preventable deaths every year and placing a heavy burden on healthcare systems. Obesity is primarily caused by poor lifestyle choices, including unhealthy diets, lack of physical activity, and environmental factors. While genetic factors play a role, lifestyle remains the key driver of this epidemic. The good news is that we have the power to change. By focusing on healthier eating habits, increased physical activity, and creating supportive environments through public health initiatives, we can make significant progress in reversing this trend. Policies and education also play a crucial role in creating a society where making healthy choices is easier and more accessible for everyone. In the end, addressing obesity isn't just about individual choices, it's about creating a world where everyone has the opportunity to live a healthier life. We must work together at all levels, individual, community, and government, to fight this epidemic and reduce the impact of obesity on global health. Thank you for watching this video on the global obesity epidemic. If you found this information helpful, don't forget to like, subscribe, and share this video with your friends and family. By spreading awareness, we can all contribute to the fight against obesity and promote healthier lifestyles for everyone. In our next video, we'll explore how governments and communities around the world are working together to address the root causes of obesity and create healthier environments. Stay tuned, and let's continue this important conversation. Together, we can make a difference.